Good afternoon, ladies and gentlemen. Okay, it's a pleasure to see our awesome faces. I hope we were really, touched by that first panel session. Okay, so we're going to another one, and this will be focusing on improving health for economic growth. A quick breakdown. Well, this panel session will focus on the importance of and returns on investment in improving health outcomes, towards harnessing demographic dividend, and we'll work to explore the role of the private sector, very key, in leading and supporting health-focused interventions in order to maximize investment in our human capital as a country. We hope to provide information and key learning that could inform areas for private sector investment and partnerships, and of course achieve a better understanding of DD and arising from such investment. So I would call on members of this honorable panel in a particular order. I would call on Dr. Omolasho Omoshe. He's Assistant Representative and Head Lagos Liaison Office of the United Nations Population Fund, UNFPA. You're very much welcome, sir. He served as the head of the UNFPA Lagos Liaison Office, especially since 2011. That's a long time, so we have a wealth of experience to glean from today. Also, please join me welcome Dr. Sylvia Adebajo. She is Country Director, Population Council. Please, a round of applause as she comes up. Okay, she is a public health physician and epidemiologist with more than 15 years of experience in communicable disease research, programming, evaluation, and academia, both within and outside the shores of the country. Right, but she stepped out. Okay, we'll await her. Hope she gets back in a moment. And another gentleman on the panel today is Dr. Omasanju Waije. He is State Team Leader, Nigerian Urban Reproductive Health Initiative, NORI. Thank you very much, sir, for joining us. Please, a round of applause for him. He's a medical doctor and a public health specialist with 8 years work experience in clinical medicine, public health, and the health sector development. Of course, trainings within and beyond the shores of the country. And also, let's please make welcome Oluwashijibomi Paul Ojajuni. He's Director, Research and Development, Hazy Health Initiative. Thank you for joining us. Paul is co-founder of Hazy and currently directs research and development for the organization. This young man, you see, has over 9 years of experience as an international development and public health expert, mostly in policy advocacy, private sector engagement for development, health system strengthening, etc., etc. All right, so we are waiting Dr. Sylvia. We hope she can join us. Could the ushers please help inform her? We really need her to join this team now. So let's just wait some few seconds for Dr. Sylvia. Okay, it's so good to have you all join me on this panel today. And of course, the theme is improving health for economic growth. So we want to talk about what the private sector can do. So much has been said. The private sector has a huge responsibility, but perhaps not many of us know what the private sector is actually expected to do in all of this. So I would like to start with Dr. The representative of the UNFPA here today, Dr. Omoshe. We've heard over time that family planning programming can really result in... Okay, please, may I have the second microphone for the panelists, please? Thank you very much. Thank you very much. All right, so we've heard over time that when we invest in family planning, it has a way of accelerating economic growth. But we want to know why. I mean, how rather? How can we achieve this? Dr. Omoshe. Could we have the technical team help with the microphone?
Yeah, thank you very much. We have watched the video, I believe. In several ways, investing in family planning can actually help to accelerate, economic growth. One, we do know that there are a lot of women out there, a lot of couples out there who have unmet needs for family planning. When we talk about unmet needs, we're talking about couples who want to do family planning, but they do not either have access or the commodities are not available. So, and when we have unmet needs, we're talking about two different things. I mean, we're talking about, one, unmet needs for spacing. We're also talking about unmet needs for stopping childbearing. Now, when we talk particularly about spacing, we will want to look at the health of the woman, want to look at the health of the children that she already has. If a woman is not able to space, her children adequately, it affects her health. It also affects the health of the children. Now, you can imagine spending on health just because you cannot get access to family planning. Money you will have spent on something else, you are spending on health. Now, talking also about, stopping. For instance, a woman decides she wants to have 4 children, and because she does not have access to family planning services, she has 8. She has extra mouths to feed. Apart from the feeding, you need to take care of the children, send them to school. If they are sick, you want to take care of their health. That is extra spending. So you see, investing in family planning will help to reduce all these costs. And of course, the money can be veered into other areas of economic, growth. We also want to look at the empowerment of the woman herself. A woman who has access to family planning can also plan her family in such a way that if she wants to go back to school to take extra courses, if she wants to go to work, she's able to plan her family in such a way as to accommodate these ventures that will bring in extra money for her.
All right. But we're really looking at the how
Yes.
these can happen,
Yes.
how the private sector can play a role in helping the woman achieve all of these things we're talking about. Because there are some workplaces when you apply and the interviewer discovers that the last time you worked was maybe 5 years ago, question arises as to what have you been doing all along? Perhaps the woman was training her children, now they're grown enough for her to resume work, but then she's laid back at work. So what happens? How can the private sector intervene in such circumstances?
You see, all these areas that I've mentioned need some level of investment. For instance, we need to move these commodities around from the store to where the woman can access them. That needs investment. We need to make sure that these commodities are readily available. The procurement of these commodities, that needs investment. When we talk about the woman, who needs to take care of her children, that needs investment. And these are areas where the private sector can come in, to augment whatever the government is doing. Because the government cannot do it alone, definitely.
Of course, the government cannot do it alone. Let's come to Dr. Sylvia. Of course, you have been involved in this for a really, really long time. Do we have policies in existence that, that can inform private sector investment in all this? Because the private sector could be willing to do something, but if there are no policies to support their ventures, then they wouldn't really be able to do anything.
So, thank you so much. First, successive governments have put in place different policies that can regulate and control and also guide, the delivery of healthcare services in Nigeria. Now, there are quite a number of these policies, starting from the national health policy, for example, within which you have provisions for the private sector to be engaged and participate and be involved in healthcare service delivery. You have the National Primary Healthcare Policy, which is meant to deliver the universal basic healthcare. You have NAFDAC, you have the NACA, which is National Agency for the Control of AIDS, you have the National Health Insurance Policy, you have the National Pension Scheme, and there's so many. So it's not, my issue here, is not the lack of policies. We actually have the policies. But the problem is, to what extent are the private sectors and, dare I say, even government and donors and implementing partners aware of these policies and the contents of the policies? So that's one concern I have. And that's one area maybe the private sector can also help, to increase their awareness of the contents of these policies. Two is to ensure, the policies are there to ensure that there's equitable access to healthcare services at a cost or at costs that are affordable for people, and that there's equitable distribution of the facilities and services, not just in the urban areas as we have right now, but also to rural areas and to the very vulnerable and people most in need of the services. That's where the private sector can come in. My colleague just mentioned about access to family planning services, but then to what extent the supply chain, how can we get these products distributed, to the nooks and crannies of the population, and then what about the quality of healthcare providers? You have brain drain, where healthcare providers are trained. No sooner they are trained, they're getting out. So we're leaving behind people who are either not motivated enough or going into other types of jobs, but not healthcare. Now, what are the reasons for this? I think that's where research is very important for us to know. But I think part of that is because they're not well rewarded, or that the healthcare services themselves are not well equipped. And so there's no reason for no attraction, for them to work in such areas. And that's where I think the private sector can come in, and they have a huge role to play. Finally, there are lower cadres of staff, healthcare providers, i.e. Patent medicine vendors, traditional birth attendants. That's where the majority of Nigerians go to. Those because they can afford, those are the services that they can afford. They can't go to the private, facilities or to government.
Standard in those places.
That is the problem, and that's where the private. But rather than ignore or turn blind eyes to those cadres of healthcare providers, why not tap into that critical mass, train them? Because whether you train them or you don't, they are providing the services anyway and giving injections and doing everything. Why don't you train them? And that's where the private sector can come in and work with government. So I think it's about time now that we'll stop working in silos, but recognize that the private sector is there, government is there. We should work together. So, and that is what the government should actually harness, all the efforts from the private sector, bring them on board, and that's what this session, this meeting is all about. All right, that we're all sitting around the table to discuss and identify the gaps.
Okay, and government shouldn't be afraid that the intervention of the private sector could make it seem irrelevant.
Yes.
Because there could be such fears,
Exactly, and at the end of the day, if we harness demographic dividend, who actually will gain from that? It's the government,
of course,
isn't it?
yes.
We want a healthy government.
Of course, it's all right. Thank you very much for that. A round of applause for her, please. I think we should maintain that rule now. It's a good something. All right. Let's come to Dr. Edun, please. Now, you've worked with Nuri. Nuri is currently on phase 2 of this project to, bridge the gap between supply and demand and all that. From experience, what do you consider the most pressing actions that government, development organizations, private investors should address for us to actually achieve this demographic dividend, DD?
Good afternoon, everyone. So for me personally, I would say the present challenge would be actually, you can look at it from both sides, demand for family planning and supply. And Dr. Moshe mentioned a bit about the supply, but also a lot has to do with demand as well. A lot of people do not intend to use family planning, but at the same time, a lot of people do not have access to family planning. And when I say access, I mean whether it's information, whether it's the services, people just don't know where to get this information. And sometimes people don't even trust the information they get, because we know that there are lots of myths and misconceptions out there about family planning. We've heard a lot. And the private sector needs to begin to realize that the people we're talking about are their markets. These are the people who will buy your products. These are the people who would use your services. So the healthier the population, the better for the private sector. So that's why they need to start looking into investing into the private sector. Now, I've heard a lot about the discussion that's going on since morning, and quite honestly, grand ideas, fantastic ideas. But I still think a lot is still being focused on the now. Skills acquisition, yes, good idea. But we're talking about people who are already in their adult age. But we forget that, and I'll use the iceberg as an analogy. What we see now as adults have been preformed from our childhood. A lot has gone into us being adults, our education, the nutritional status when we're growing up. Now, while we are focusing on trying to improve the skills of adults, what are we doing about the children who are coming up? Are they getting proper education? Are women spacing their children so that they can provide better for their children? Are they providing immunization services? What's the healthcare status like at the grassroots level? Because if you create a critical mass of young people, we have over 70% of adults less than 30, and the percentage of that 70% that are actually workable is 2%. So no matter how much mass you create, the quality of what will come out of the economy is almost next to nothing. So if we don't start looking at, if the private sector does not start to think the long term, let me begin to make sure that women who need family planning, because we know that once these women have access to family planning, they are better able to provide for their family. We say this in Nori, if you do family planning, chances are that you'll be able to break out of what we call a cyclical generational poverty. It means you can invest, save for the future, invest in your children, provide quality education. These children will in turn carry on that habit and then continue the cycle. Now, private sector needs to understand that they need to create demand for family planning. People need to be aware. Young people need to be aware that these services are out there. I'll give you an example. There's a program on MTV called MTV Sugar. If you listen to that program, it hits the nail on the head. They don't miss words. They don't say, oh, if you do this, you might get this. No, they say it the way it should be said, because adolescents need to hear the truth. So private sector needs to start looking at investing in areas that would actually provide this information to young people and to mothers out there. And then if you look at the supply side, not everything has to do with money. One thing the private sector has gotten right and has done really well is supply chain management. You see the likes of the Coca-Cola in every sector and every corner of our community. You see the Dangotes, you have cement stores everywhere. So why do we still have challenges with supply chain management within the government sector? Why can't we have people do internships from government organizations in private sector so they can learn how this system work? We're not saying private sector bring money. We're saying let them come, do 3 months, see how the system works. I understand the private sector is really competitive, and we're trying to guard our secrets, very jealously. But there's some things that you can let go, because at the end of the day, it's for the overall good of the community. If the community is healthy, sick people will not buy MTN credits, to be honest. Well, poor people will not buy cement to build houses. It's the rich. So if you need to sell more cement, you need your population to be healthy. So the private sector, because they stand a lot to benefit, and the more the private sector absorbs, the less the government has to deal with. Then the government can actually focus on good governance, and they begin to provide what we need to run the economy. That's what I think.
Very beautiful. A round of applause for him, please. And then listening to that point, I'm also thinking about communities where the private sector is willing to invest. The private sector comes around, and of course the private sector could have met with the government, but governments are in strata. There'll be some governments might not necessarily be recognized as government, but people who have authority where the private sector wants to invest. And then we know there are some companies that want to organize CSRs, and then they are told, bring the money, we'll fix it. But when time lapses, nothing has been done. And then the private sector just decide, okay, we no longer release money. We would rather go ahead and implement the project ourselves. So in such instances, when the private sector does not trust the system, there is a moral burden. How do we fix that? Okay, who would help us with that?
Thank you very much for that question. What you just explained is a typical systemic failure, such that there is no synergy between the private sector and the public sector, and that is why we're here. One of the things we want to take out from here is such that we have the private sector, we have the public sector, we have the non-profit, we have major stakeholders come together to build frameworks that actually work. So Dr. Silva mentioned that there are so many policies that are there, youth policies, and recently we have the roadmap, to enhancing demographic dividend. The most important thing I would say is that such policies should be translated to action, and I think that is what our problem is. Yes, that is what the problem is. There are so many policies, but then they are not being translated to actions. The way the private sector can help do that is, as I said, to form synergies, in conferences like this or in meetings like this, to develop frameworks that can work, that are sustainable and are smart. I think that's what we need to do, and that is what we should be thinking, for the future. That's what, at the moment, we should be thinking, and not, what we're doing at the moment.
All right. I think I really like that part, something that's sustainable, synergy. Okay, Doctor, I don't want to add a point, please.
Yes, just as an example, there's something in Nori that we do when we support a particular health facility in the community. There's something we call a 72-hour clinic makeover. We call it 72-hour clinic makeover because in 3 days, we go into a facility and totally renovate the family planning clinic. We go on a Friday afternoon. We do everything from breaking down walls to bringing them, setting up, buying the equipment, arranging everything, and by Sunday evening, we are done. By Monday morning, we commission.
Wow.
Now, when we started, people thought it was impossible because you know what it takes, the bureaucracy, to get government to do stuff. But we said we were going to show government that these things can be done within the shortest possible time. Right. Now, the reason why we do it over the weekend is because we don't want to disrupt clinic activities. So you close work on a Friday, and by the time you come back on the Monday morning, it's a brand new facility. Yeah. Now, how did we get it done? We did not use a single contractor. Every artisan that was used came from the community. The laborers, the carpenters, everybody, the electricians, everybody, name it, came from the community. Now, when we were telling them what we wanted to achieve, even the artisans were saying, Oga, it's not possible. And we said, don't worry, it is possible. And by the time we finished, the World Health Committee chairman or members would tell us, even the OIC or the facility would tell you, I never thought it was possible. So all we need is, we need to put things in place that work, and then we have to back it up with action.
All right. We
were staying there Friday night, Saturday night, Sunday morning. I was in that facility every day. And I tell you, we have done 54 or 60 facilities across Lagos State. And in a weekend, we do 4 facilities in a weekend across the length and breadth of Lagos.
I think all of those require, a round of applause.
So these things are possible. We can do them. Sometimes we have to do work overnight. There was a facility in Ojo local government where we said, we can't do this because it will cost us time. But when we finished, we realized that we had to change the tile of the facility. We noticed it at 7 p.m. in the evening. Commissioning was 9 a.m. in the morning, Monday morning. We said, do you know what? bring in a generator, break the tiles, we'll fix it. And by 10 a.m., we commission that facility. So it's doable.
All right, very doable. Having square pegs in square holes and round pegs in round holes. Let's come to you, Paul, now. We have been hammering the issue. Let's have more women, have access to sexual and reproductive health. Let them know about this issue. Let them, know about family planning, encourage them in all of that. What potential does this have, economic potential now, for our nation if we are able to achieve a scenario where our women and girls are well-grounded in the subject matter?
Thank you very much for that. Dr. Almost saying clearly explained a lot of things, and then he mentioned how, or the importance of empowering women. That was the summary of what he said. Now, when a woman is empowered, when she has the right knowledge, she can make informed decisions. She can make decisions that would affect her, that would affect her family, and would affect the society. So the woman is in the center of everything we're talking about. So in many countries that have actually harnessed demographic dividends, like many Asian countries, like the Asian tigers, Taiwan, Singapore, Hong Kong, and South Korea. One of the things they did was to improve women education, and then that resulted in accelerated economic growth. So that is what we should be doing here. Now, when women have the right knowledge, they have access to family planning services. That would mean that they will make better decisions. Probably they would have lesser children, and then the dependency ratio would reduce. Because one of the things that the challenges we're facing right now is the dependency ratio in Nigeria is really huge. So in really harnessing the demographic dividend, we need to achieve all of that. Now we have lower dependency ratios, and then it is expected that would have accelerated economic growth.
All right, and as we talk about the involvement of women, we must also remember the men, because a woman doesn't stand alone in family planning. It has to be very much collective. Do we have any comment or questions from audience members? We have very few minutes for those. Okay, Dr. Moshe wants to add to that, but if you have questions or comments, okay, we'll take that later. So let's have a final
Yes,
comment.
I think I should add that, before you become a woman, you are a girl or an adolescent. And sometimes if we do not act fast to invest also in the adolescents, we find that by the time they enter into adulthood, their reproductive health is already, tampered with. So we need to also emphasize, the aspect of looking at the economic value, of investing in girls. Let's catch them young. Let's give them the necessary information they need right from that time before they are exposed, to the vagaries of the world. I think I should.
All right, very good. Okay, all right, please.
Just a quick one. I liked what
Dr. Edron?
Doctor. Okay. Yeah, from Nuri. Well, I liked all that he said. But my only comment there is, and that's the contributions of the private sector. That whatever it is that we do is to engage to ensure that government actually leads the process because of sustainability. Right. Because once the funding ends, what's going to happen? What would be great to see is that years to come, each state or local government will do exactly what you're doing now in 10 years' time. If we can do that, then we have achieved a lot. But most times, government is also left behind, and really they should actually lead the process and own the process.
All right, so everyone should be involved in the process. So let's can we make a chant? Lead the process, get involved. Let's try to do something like that. Lead the process, get involved. And then maybe you also say to yourself, mention your name. Abosede, I'll lead the project and I'll get involved. Thank you very much, gentlemen and the lady, for being here. And of course, you are a very esteemed audience. Thank you very much.